I'm Michael Reese.
And I'm Woods Davis.
And this is the Digital President Podcast.
We've cracked the code for generating customers online for every business model.
In fact, we wrote the book on it.
We've built multiple multi-million-dollar businesses in as little as 90 days. And the one truth that we discovered is
the best business model is doing what you love and living your life by strategy.
You truly can follow your passion and create the life of your dreams,
as long as you have the right strategy.
If you're a real estate agent and you'd like to learn how you can partner with us to help you implement our strategies and systems in your business so you can make a lot more money and have a lot more time freedom, all without ever paying us a penny or giving up a percentage of your commission, go to partnershipdetails.com and schedule a call with us today. While it's fresh in your mind, go to partnershipdetails.com. Now on to the podcast.
All right, welcome everybody to another episode. And exactly like I said, you will not want to miss this one. We got Margot Wickersham, and she is with Clearwater. And Clearwater is an insurance company that so many agents are excited about, and we're going to unpack that for you. If you're an agent and you don't have health insurance, or maybe you have health insurance but you're paying too much, or you have health insurance and you don't get the coverage you want, well, this is the go-to person that I would endorse and call. And the great thing about it is being at EXP, if you don't know, you get access to these types of programs. And I get asked all the time, hey, Mike, I know you at EXP have this HealthCare plan, but I don't know much about it. How does it work? Margot, first of all, welcome. And how would you answer that question for an agent?
That's easy because I get that question a lot also as I'm going out and presenting what's available to agents. I'll start with that. 2 years ago, Clearwater Benefits and EXP partnered together to provide EXP Agent Healthcare plans. We are a licensed brokerage and we are licensed in all 50 states. And what that means is that we can bring a wide variety of plans. We're agnostic on which ones are the best ones for agents. We work for the agents, and our goal is to help them find the very best plan for the least amount of money and help them get enrolled if that's what they want. We have a team of consultants who are subject matter experts and who understand what the different ins and outs are. It's interesting when I ask people in presentations, give me one adjective to describe the experience of shopping for health insurance. It's not ever been a good one. No one's ever said delightful, amazing, fascinating. The words are always confusing, overwhelming, nightmare, torture. These are the words I usually hear. And so what we do is deliver a service that's available to EXP agents and agents that are thinking about coming to EXP to let them understand, to help them determine which plans are the right ones, break it down for them, provide the service, and help them get enrolled if that's what they decide to do. So what we have is a variety of different plans available, and we are constantly, like EXP, innovating and looking for new plans, new solutions, new and different ways to solve the pain points that self-employed people like real estate agents endure when it comes to health insurance.
Well, the crazy thing, and I'm just going to speak freely here, and this was my experience when you came on board. I thought it was a brilliant idea. I just didn't think it could be pulled off, right? And so, I thought that the insurance, because I heard it kind of as I was like, man, talk about a value proposition. I've experienced this pain. I've been through this process, right? And so I knew it was a real problem. I just didn't think it was real. That's the honest to God truth. I was like, man, this is like Aflac, maybe if something happens to you, and I don't even know how Aflac works. I just know that it doesn't seem like the same. It's not going to cover my wife who's pregnant or, somebody who gets sick, like real insurance that you need. And for me, I shared this with you the other day. I told people, every single person, I wish I could use their names, but there's, I think, a little bit of privacy. But I had a guy that shared with me, he said, hey, Mike, listen, we did the whole talk about coming to EXP. He liked it. And I just mentioned healthcare, and he said to me, Mike, because of my situation, I'm paying XYZ in medicine. It was basically almost $10,000 a month for prescriptions. And he did a free consultation. It was on a Friday. I said, well, I don't know but I know that everybody does a consultation. If there's anyone that would know, you need to talk to them. And he said, the only reason my wife has worked the last 3 years is so I could have insurance. That's the only, if literally what you're saying is true, if it's equal or better, you are retiring my wife. He called me on Monday and literally he was in tears. And that was the first story. And I was like, well, maybe there's something there, but I didn't go back and check it out. Cause like you said, it was confusing. I had to go through that with group plans. You know, when we had 64 employees, it was the one meeting I never wanted to be in. Right. And then I had another guy who had been a friend of mine for 10 years and he came over and I guess he checked the box or did something, but took up, and you know who this is, but he ended up, he came over in June and found out he had throat cancer in July, and absolutely same experience. And that's when I said, this is probably the strongest part of the value proposition that is just, you know, a lot of people don't know about. So first of all, thank you for coming on and sharing with everybody. You know, what would you say to somebody who, you know, what does the process look like? I'm looking to come over to EXP. I'm not really sure, but I want to learn more about the health insurance. What do you tell those people to do? Do they have to wait to come over to learn more, or how's that work?
No, they don't. And if you think about it, that provides a huge value to EXP agents who are looking to grow their business by attraction, because you can put the power of the savings and the benefits of the healthcare insurance plans in the hands of the people you're talking to before they make the decision. And I can't even tell you how many agents have told us and told our consultants on the phone, this is the straw that broke the camel's back. That's probably not right. This is the icing on the cake that solidifies my decision to join EXP. I mean, EXP is so agent centric. There's so many different reasons to join EXP. And what we know is that health care costs and health insurance costs are so high and so stressful. It is the number one thing behind compensation that people care about. For a lot of people, the cost of healthcare, health insurance, is the same as a second mortgage without the second home. So we are seeing people make decisions on the phone when they're with us. Okay, that's it. I am absolutely coming over right now. This is the deciding factor. And we have some videos of EXP agents who have recently joined because of the health insurance plans on the website. So to answer your question, agents who are considering moving to EXP, brokers who are considering moving their teams to EXP can access information about what these plans mean to them and to their families before they join as part of their decision-making process, so they can get that information ahead of time.
So they can basically have a consultation with somebody that I'm sure is obviously confidential, where they can share their information and figure out what. Because a lot of people, they say, well, what's it cost? And, so they can go through that whole I always tell people, well, it depends. You got 1 kid or 10 kids and who you're insuring, right? It's different for everybody. But that is a big thing that I think is important to people. So they can get that information without making the commitment.
They can. We're creating new and different ways to get this information out to agents so that they have it. They can get that information and the resources to make a good decision. One of the things I see coming on board soon is we're going to start doing more and more deeper dive webinars, and those will be live so that questions can be asked and we can extend the access of the team to more and more people as we go into open enrollment season, which is always a very busy time. So we have a website dedicated 100% for EXP agents, and it's expagent.healthcare.com. And agents who are already EXP agents can visit that, and there are resources there. There's videos with stories from EXP agents. There's information about the plans. There's access to the webinar schedule. You can book a call with a consultant. So there's a lot of different resources there, and we're always adding to it. So we do invite agents and brokers who are considering to visit that site. They can absolutely register for a webinar, book a call with one of our consultants, and they will tell the agents what the best options are. And you're right, it depends on your family situation and then some other choices that you make. Deductibles, as they go up, the cost goes down. So there's a few options there. And there's how fancy of a program do you want? How rich of a program do you want? If you are a family with a lot of kids and you want all the bells and whistles, we've got a great plan. We call it the copay plan. That is a good option. And then it depends on whether you want that one, or would you like to have a plan that is a little lighter. It still checks the main boxes. You get your preventatives included, and it also takes care of you if something happens, you need to be hospitalized, or you have the need for a procedure or cancer diagnosis, you need treatment. But it doesn't have as many copays for specialists and that kind of thing. We call that one the HSA. It's a health savings account eligible plan. You don't have to have one. So we've got different options. That just gives you a couple of different kind of bookends to look at. And it depends on where you are in life, where you are in building your business. And if you're cash strapped, we've got some other plans. We kind of call them the basic plans, and they're sort of catastrophic with some telehealth. You know, if somebody's just starting their career and right now is not the time to invest heavily in a plan, but you want something in place, we've got an answer for that.
That's awesome. Can I ask you one question?
Absolutely.
This because the real question that's always come up with for me, Margot, is and you answered this question. That's why I'm asking it, because it blew me away. And you had your own, I think your founder or someone was on the call when I first had the opportunity to hear you both speak, and it was an amazing backstory. But for me, when I first heard about it, I just thought, well, if it was this, how is this a differentiator is what I'm getting at. Like, if this is real, then why isn't everybody doing it? If it was this easy, why, or is there something special here at Clearwater that's really added to the differentiated value proposition of the agent-centric, EXP Realty cloud-based model? Is this something that, hey, other people are doing this because they couldn't in the past? This is something that had been discovered, and that's why this is available now and hadn't been available in the past.
That's a great question. And I'll answer it this way. In our country, health insurance has been delivered through employers. I'm not interested in getting into a debate, and neither is anybody else, about how that is or how it came to be. It doesn't matter. We're where we are right now. And what that means is that there is essentially a bias towards group insurance, meaning that if you have access to a group plan through employers, then you have access to the best plans. And then by definition, that means if you're self-employed, you do not have access to group plans. You only have access to plans for individuals, which in our world is mostly plans on the exchange. There are some plans off the exchange as well, but these typically are expensive because they're not set up like groups. I won't get into how the whole thing, you don't want to know how this hot dog is made, but suffice it to say that group is where the best value is for individuals, and having access to group as self-employed people has been the problem, the challenge. And like Glenn Sanford and so many of the people who've helped grow the EXP business model, Doug and Jason Sherman, our founders, created a way. They thought there's got to be a better way. And it was hard. It was really hard and complicated, and we were constantly finding new and better ways. We are constantly finding new and better ways to bring group level plans to individuals. And other companies could do it. Other brokerages could do it. We have found that they're not. And so, like EXP, we are pioneering a big disruption in the healthcare industry, the health insurance industry. It's one of the reasons that our two companies, EXP and Clearwater, are such a great fit as partners. We're so aligned culturally. We are technology forward. We are agent and customer focused. We are, just because it's not been done this way doesn't mean it can't be. If this is the better new way, let's try it, focused. And so, for example, you would think, well, wouldn't associations have access to, with all those people, to be able to produce a group plan? And you would think so. That actually isn't how it works in the long run. And what happens is NAR, National Association of Realtors, does have something that they offer, but every single realtor that I've talked to who've gotten a quote there 100% of them have said that's so much more expensive. It's probably essentially a plan on the exchange, and those are the most expensive. By the way, they are a fit for some people. For a percentage of the population, that's actually the best fit. But you don't know that till you ask a few questions. You understand what a household's needs are, and how they want to go approach paying for healthcare. For example, 30% of real estate agents have no health insurance. That's not a slam against real estate agents. That means they're self-insured, because it's so expensive that it isn't worth it to them to pay for a plan that doesn't serve them very well. And so we want to make sure that agents have something in place. Right now, if you're self-insured and you end up in the hospital, you are probably on a GoFundMe plan. That's what we see a lot of people doing. And I don't know how well that's going to work for everybody. So we'd like to see you not have to stress about healthcare and how you're going to pay for the best care. So it's something that is very near and dear to our heart. So to summarize, we have a focus on innovation and technology. And I'll share a personal story with you. When I was first interviewing with Doug and Jason Sherman, and they told me they cracked the code on how to provide group level plans to individuals, because I'd been in this industry for a couple of years. I said, it's impossible. You can't do it. So I'd like to see how you do it. I mean, how? Are you just telling me that? It's kind of the same question you had. How is that possible? And the bottom line is they didn't take no for an answer, and they kept digging, and they found a way to craft plans that deliver the value to self-employed people. And once I saw that that was actually what they're delivering, I was sold, because that is such an underserved market. I mean, there's over 1.5 million real estate agents in the U.S. alone, and a third of those. So I'm not great at math, but that's a lot. Hundreds of thousands of agents are out there without any plans at all, and we can bring something to them. And for another third who are enrolled in a plan on the exchange, we can most likely save them a lot of money and get them better access to care.
Man, that's incredible. Well, the funny thing is that, that crack the code. That's what I want people to understand. This isn't something that's disguised as something else,
Right.
to be able to just say we have health insurance. I mean, this is legitimately an innovation. And that happens all the time. It happens in the cab industry. It happens in, one thing that just as this is a short, real quick point. I was with a guy, and he was an investment banker, and he was telling me about how renting your own car, that industry was cracked because of an insurance policy rider on the car, right? Like, so people can park their cars almost like Airbnb for their car, but the innovation came because of a change in insurance policy riders that allowed this entire market to happen. And so these types of things happen all the time, where there's a change or somebody looking at approaching a problem differently, and they actually come up with a solution. And I feel like people need to understand, that's what you do. And I know that I shared a little bit of the questions that I've had, and for my own personal self, because I've had insurance and I do not mind paying. I pay a lot for health insurance. That's just one thing that I don't mind overspending on. I think you'd probably fall out of your chair if you've known what I paid. But because of that, I had false information, because like one of my biggest things was I was told, well, because my wife, she doesn't want to change doctors. And so they're like, well, if you go with this plan, I looked at everything, you won't be able to use Dr. Gardner no more, and this is I'm just making up a name. Right. And that wasn't true. And so I think the best thing you can do, if this is something that interests you, if this is something that you're looking for, if this is a solution to a problem you have in your life, whether it's for you or one of your loved ones, and you really need to have health insurance, or you're overpaying, I think you should really take the time to reach out, go to the website. What was the website again?
It is EXPAgentHealthCare.com.
Absolutely. Go check it out. You can schedule a call. Just in closing, is there anything that I didn't ask that I should have asked, because I know you talk to so many agents?
We do. Well, Yes, there are a handful of things I want to touch on that we get asked all
Yeah.
the time, and one of them is, well, do you have the other things like dental and vision? We do, and you can enroll in just those things. You can enroll in those as you enroll in a healthcare plan through us. I mean, it's kind of a la carte. So whatever makes the most sense for you, we can do. We also have life insurance. That is something that is, it doesn't sound exciting, but it actually is kind of exciting because we're able to bring life insurance that is group level quality and cost savings to self-employed people like EXP agents. And we've got disability coming up soon, that you can buy a plan like that. And while people are working on their passive income, until they get to a certain point, if they don't work, they don't earn, and having a disability policy in place might be the right thing for them. Um, and then additionally, we're constantly pioneering and finding new plans. And we've got some big things coming up that I want to come back and talk to you about once we can talk about them. And there was one other thing that I wanted to share. Oh, you mentioned Aflac-like policies. Um, Aflac policies are the ones where you pay a fee every month, you pay a monthly premium, and then if a qualifying event like an accident or you get a cancer diagnosis or a stroke happen, then you get a lump sum for those things. And EXP agents have access through Clearwater to critical illness policies, accident policies that pay a lump sum when you get a diagnosis or you have to have that kind of treatment. And those are great because they can help offset any out-of-pocket costs that you might have, which are much lower on the Clearwater plans that EXP agents enroll in. But this can bring it down to zero or a net gain, which it's nice to have options. So we do have those available. And one of the things I wanted to share with you are some highlight. Okay, so there's two things I want to share with you. One is that this is absolutely a competitive advantage. Literally no other nationwide brands of brokerages have anything like this at all. They all know it's a problem. There was an Inman article back in February by Jim Dalrymple. He interviewed Jason Gessing and he interviewed executives at Coldwell Banker and some other big names. And they all nodded in agreement and said, yes, we know this is a problem. We want to solve it. We just haven't figured out how. Meanwhile, EXP has, because you found a partner who's figured out how. That's us. So we have an agreement. We have an exclusivity agreement with the EXP that we don't talk to any of the other nationwide brands. So this is not going to be available through Keller Williams, Century 21, Coldwell Banker, Remax, Compass, Realogy, any of those. So that is an advantage that EXP agents have for attracting other agents. No one else has this. It is a substantial feather in your cap, arrow in your quiver to attract agents. We see a lot of attractors using healthcare as the conversation starter. It depends on what matters to the agent you're talking to. And for a good for a good section of them, about half of them say that health insurance is a really big deal. I mean, think about if you are talking to someone who is a career changer. Maybe they've been laid off or they're ready to have the sky be the limit for their income. They want the freedom and the opportunity that they can enjoy if they join EXP. If they're leaving a day job, they're really concerned about healthcare because that was baked in. And this removes that problem because the cost is so much more affordable for most people. Even when you take into account, let's say you have a family and you've got the husband is working at a company. He is interested in leaving that company, but he's got a family. He doesn't want to give up the benefits, obviously, but he wants to make this leap full time. He doesn't want to have his feet in two different worlds, trying to be a husband, a dad, a worker, a business owner. What we know is that he can make that leap using the EXP agent healthcare plans and probably get his whole family covered for what he was spending out of pocket, or maybe less before. So that's a really big advantage.
Oh yeah, that's a great advantage. And like I said, for me, it's I really believe it's probably one of the strongest reasons. I mean, for me, when I could see if everything was just the same, just having that, everybody puts a different health insurance is one of those things that you don't know how important it is until you needed it, right? And I know so many
Oh,
people say
yes.
it is one of the reasons that cause a lot of financial hardship on people who don't do good preparing, and that and that there was things that you said today that I could go off on a tangent. I was speaking to some super successful guys last night during the Dallas Cowboy game,
Ooh.
and we had a conversation 100% around disab- um, disability insurance. My stepfather passed away, but it happened out of nowhere, and he got dementia, and he went down. I guess it's called long-term health care. And my mom, she does her homework. She's a retired command sergeant major. And so she is very, crosses her T's, dots her I's, had insurance from the military, but still thought it was important to get this extra coverage, and told me about it. She always wants to update me on where things are, so she's never a burden. And she ended up having to use that. So I was telling a guy last night who was adding it to his policy. This is a guy has a hedge fund, super ultra successful out here, and he has a lot of experience. And he said, he actually is a wealth manager. He manages wealth for high net worth individuals. And we're watching the game, and I just was asking him about this same policy, and he was telling me that he was adding it to his coverage. And I asked why, and he said, one thing I learned after managing high net worth individuals, even when they have a lot of money, if something happens to you, and now the family's responsible for paying those bills, sometimes they will cut corners and spend less. And you know what I mean? And especially, if you're not a high net worth individual, let's say you have, they'll go the cheaper route. So, for your own self, giving them that resource and that money to be able to help take care of you. Not to mention if they take care of you, one adult taking care of another full-time adult, I know knocks off so many years of the other person's life versus having that long-term disability and being able to bring someone in. And so it's just, if you're not thinking about it, you can go fast in the wrong direction. So I recommend everybody, if you don't have health insurance, if you haven't taken the time, to pause, this is one of those things that is a great investment. And I think it's a duty and responsibility to you and your family. So go check out the website. I so appreciate you jumping on with me today. I'm excited to go back and just listen to some of the things you shared, because it's totally enlightening and it's new in our industry. So thank you so much.
It's my pleasure. I love sharing what we can do to help agents. It's very rewarding. Our entire team is talking to each other on Slack and saying, can you believe we get to do this for a living? Hear these stories about how we're helping agents save money, get a better plan. It's very rewarding. And we love what we do. And we love working with the EXP agents. And we look forward to a big, bright future together. Thanks so much for having me.
Thank you so much. Like we always say, we either see at the top or from the top. Y'all take care.